Did you know that you could learn how to save a life in a little more than 20 minutes? Many people feel helpless to act during a cardiac emergency because they lack the knowledge on how to help. Anyone can learn CPR and first aid techniques. The purpose of my speech today is to persuade my audience that CPR could potentially save a loved one's life one day. Why learn CPR and first aid techniques, you might ask? Well, cardiac arrests are more common than you think, and they can happen to anyone at any time. Nearly 383,000 of cardiac arrests out of hospital occur annually, and only 88% of cardiac arrests occur at home. Many victims can or do appear healthy with no heart disease, currently, or any other risk factors for that matter. Sudden cardiac arrest is not the same as a heart attack. Sudden cardiac arrest occurs when electrical impulses in your heart are rapid and chaotic, which causes the heart to suddenly stop, which is then cardiac arrest. Who can you save with CPR and first aid techniques? Well, you can save anyone. You can save everyone. Anyone that's there. The life that you save with CPR will most likely be a loved one. 4 out of 5 cardiac arrests do happen at home. Statistically speaking, if called to administer CPR in an emergency, the life that you likely will save at home will be a child, a spouse, one of your parents, or even a friend. Why should you take action? Well, the failure to act in a cardiac emergency could lead to an unnecessary death. Effective bystander CPR provided immediately after sudden cardiac arrest can double or triple a person's chance of survival. But only 32% of cardiac arrest victims actually get CPR from a bystander. Sadly, less than 8% of people who suffer cardiac arrest outside the hospital will survive. So in conclusion, you can prepare yourself to act in an emergency by simply viewing the free hands-only CPR instructional video at www.cprandfirstaid.net. This video is just a little more than 20 minutes. Hands-only CPR has proven to be effective, and the American Heart Association has recommended hands-only CPR for adults since 2008.